everyone, I'm Autumn Walchak and I'm a nursing student at Commonwealth University Bloomsburg campus. Recently, I went to the eye doctor and they had me put on a VR headset as part of my eye exam. And instead of using all of the bulky equipment, everything was happening inside my headset. There were lights and moving objects that tested how well my eyes responded. And that experience really made me realize how much virtual reality is starting to play a role in healthcare. A little bit about virtual reality. It is an immersive 3D technology that allows people to experience realistic environments through a headset. It mainly started in gaming, but now it can be used in hospitals, clinics, and classrooms. In healthcare, VR can let doctors, nurses, and students practice safe procedures and prepare for real-life situations. It can also be used directly for patients for various things like pain management, anxiety reduction, and physical therapy. As a nursing student myself, I can definitely see how virtual reality can make a huge difference in how we learn. Many nursing programs are actually starting to use virtual reality for patient simulations. In the picture that I have here on the slide, that's actually from TCNJ, a college in New Jersey, where they're actually implementing VR for patient simulations. This experience allows students to step into a virtual hospital room and assess patients, make critical decisions, and even practice communication skills. It really gives us a chance to build our confidence and critical thinking skills before we ever even practice with real patients. And I just think that this is an amazing opportunity because we can learn from our mistakes in a safe environment. So outside of nursing, VR can be used in many different ways. Surgeons can use it to practice complex operations and plan these operations for things that might go wrong while actually looking at the inside of the human body. It can be used for actual patients like stroke or injury patients that may need physical therapy or rehab. It can also be used for mental health, so it can expose people to different phobias they might have in a safe environment. So that way, it's just really controlled and it isn't putting the patient at risk of harm. And how I said earlier, it can be used in eye care, just like how I did, which it's replacing really bulky, traditional, outdated equipment and making exams more comfortable for the patient. The benefits of VR are endless. It can really make healthcare more engaging, realistic, and accessible. It can also reduce patient anxiety, improve training outcomes, and allow for safer practice. For nursing students like me, it's a tool that helps bridge that gap between learning in the classroom and real-life clinical experience. But there are still challenges, and technology can be expensive, and not all schools or hospitals can afford it. There are also concerns about patient data, privacy, and whether we're relying on technology too much moving forward, but that is the world we live in, and I don't think that VR is going to reduce personal interactions with patients. It's only going to enhance it. So it's really clear how virtual reality can change how we learn, practice, and care for patients. And as I'm going to be a future nurse, I'm really excited to see how this technology will continue to evolve. Thank you for watching, and I hope this gave you a little insight on how virtual reality can be used in healthcare.